Hello, lab experts. In today's episode, we sit down with Ekene Mbachu, a driven medical laboratory scientist with a mind to upscale the medical laboratory science sector.
People who see automation just as mechanics. Yes, it is mechanics, but it is mechanics that helps us. It is mechanics that helps us grow as individuals, as a species. Without automation, the truth is, without automation, currently the medical field would not be as easy or as fluent as it is.
In today's episode, we discuss the future of diversification in medical diagnostic laboratories. Hello, lab experts. Once again, welcome to the RoK Diagnostics podcast. In today's episode, like I said earlier, we are discussing with Ekene Mbachu. And what we're going to be talking about a lot is automation. But before we get to that point, I think Ekene would like to present himself really briefly. So what do people watching need to know about you?
Okay, thank you very much, Mr. Robert. My name is Mbachu Ekene. I'm a medical laboratory scientist at Federal Medical Center, Omaha, here in Nigeria. And I work in diagnostic laboratories. I work with automated practices to deliver holistic medical checks or holistic diagnostic checks for our patients. So today we're going to be talking about automation in medical laboratory diagnostics, which is one of the fast growing actually one of the fastest growing niches when it comes to workflow engineering and progression in the medical field. The rationale, I'd like to start by giving a quick let me say an intro of what automation is or what we know automation is. Automation can be defined, that can be described as for a layman, automation may be replacing a human effort with robotics. But for a scientist or for a professional, automation could be the act or the science of machines or using robotics to perform certain tasks which can be tedious or repetitive or become redundant over time, so that human acumen, human brains can be used to perform more tedious, more
creative,
more creative tasks such as quality monitoring, quality control, and the rest. So that is a short intro for automation. And it also increases the efficiency of workflow, like in laboratory information systems and other ramifications of the lab work. It makes it easier. It makes it easier for data recovery, for to store patients' data, to do a bunch of things really. And automation has also helped. One of the key things I would say it has helped is in keeping the history or the track record of patients. Because when you're treating a patient, when you already know, like patients who have maybe some chronic disease states, when you monitor them within years or like over time, from 2 to 3 years, automation helps us to keep their results. So it gives you a preemptive ability to give proper diagnosis, like because you already know what this patient's history is.
Yeah.
Do you understand? Like, you already know what the patient's history is, and from their history, you can see whether they are making progress. You can see whether the treatment is working. You can see so many things. You can see the improvement. You can see the level of degradation. You can see so many things in the patient. So that is just one aspect of automation where it has really helped in my field and in where I work in Federal Medical Center. It really helps us to keep track of patients.
Yeah, so the automation makes us more effective, also makes us more efficient.
It does.
Now, how did you get introduced to the world of automation? Because that's something that in our countries we don't always get introduced to very early. Even in our courses, it's not necessarily an aspect that we see very often. And also when we are out there in the world and we are working in laboratories, very often in most labs, the work is still very manual, I would say. A lot of writing, a lot of changing things here and there. How did you get introduced to this world of automation?
Well, like you said, it needs to be incorporated more in our schools, because the university I went to, we were exposed to a wide range of automated machines like auto analyzers, both from something as little as a microscope to something as huge as a cryostat, for histopathological reasons. So we were really exposed to a lot of auto analyzers, to a lot of teachings. And it's not just the practical aspects, it's not just the medical literature that you need. You also need exposure to these machines so that it's not foreign, it's not alien when you finally get to use them. And yeah, I feel like incorporating it more into our curriculum in schools, incorporating, biomedical engineering and also all these forms of, biology and engineering, bringing them together in our curriculum is going to help the future medical personnel to have a better grip of what automation is about. Personally, I was introduced to automation while I was in university. I learned so much about it. I actually took a course called Biomedical Engineering, where you learn how these machines work. As a scientist, the difference between you and a technician or you and someone else is you actually know what is going on in the machine or what is going on in a test or in the testing field. Yeah, I feel like these things help. And my own, how I came to get involved in automation was from university. I was exposed to automation.
Now, when it comes to automation, there are some from not necessarily always what they say, but from their actions, there are some people that make you feel like it's a waste of time, or when you're talking to them, they kind of feel like it's a waste of time. Like they don't necessarily want to learn something new. They want to use what they already know. So what could you say to someone like that to help change their minds about automation?
Well, for someone like that, I have I would answer that question with a question. If you feel you're very comfortable where you are, then how do you grow? You need to grow. For the need for growth, for the need to grow and get more exposed, you need to get out of your comfort zone, break the barriers, find something new. That something works perfectly well or that something is okay, doesn't mean it cannot be improved upon. And if it's improved, you see other aspects of it, you see other positivities, you see other, there's endless possibilities to automation. Like it's one of the most versatile fields in medicine currently. And without it, there's so many things today that automation has brought, so many good things. It has its disadvantages, which we'll come to later, but it has brought a lot of good things. I can't even start explaining. It really does a lot.
Yeah. And so for someone who is interested in actually growing and in learning, but doesn't necessarily, let's say automation is like a wide pool or is the sea and they don't want to jump in the sea all at once. They want to dip like a leg in or a toe in. What's the smallest level that you believe someone that's new to the field could actually?
Well, for someone who is just getting into the field, there's things you can start with. For something as little as, okay, in big hospitals, you have auto analyzers and stuff. But in smaller labs or smaller clinics, you could, having a microscope microscopy. It may not seem like much, but that is a form of automation. Something as little as having a centrifugation, that's automation.
Yeah.
Mm-hmm. Something as little as very quick things that we do manually. These days they have automated practices which take away all the stress. So for someone who is trying to get into automation, I would advise that you start small. You start wherever you can, whatever you can lay your hands on, whether it be a small auto analyzer or a chemistry analyzer or anything. It could be anything. As soon as you can lay your hands on it, it can work for you.
Yeah, because one of the things also is these analyzers, like you said, they are a lot more efficient. So if you have an analyzer, let's say instead of doing complete blood counts, if, I don't know, depending on what parameters you did, maybe it took you 30 minutes and then all of a sudden you can do it in 5 minutes. And that's an extra 5 minutes that you can use to do something else, especially in our countries where we get tons of patients that need the help. If you can reduce the amount of time you use for the work, while at the same time making it slightly less prone to error, then what you have is kind of the best of both worlds.
Exactly. Like you said, it increases your turnaround time. Turnaround time is TAT in medical laboratory. We call it TAT. It's the time is the time difference in between when you receive a patient to when you deliver the result. So automation cuts it in half, even way, like it makes it so much easier. And it gives you more time to focus on the pre-analytical phases of the patient's testing, because you have more time to collect the patient, you have more time to get their proper details, you have more time to, prepare their samples for the automated practice.
Yeah.
So automation, it really helps. It really does help in those aspects.
Now, when you started, you said what you do is mostly, at the very beginning in your intro, what you do is mostly holistic medical checks. What do you put into that, into holistic medical checks, and how does automation help in that aspect?
Okay, so in medical laboratory, there are four subunits. There is medical microbiology, there is histopathology, there is chemical pathology, and there's hematology. So for a patient, for example, this is just a case study, like a patient who is diabetic and also hypertensive. If a patient comes in after being cleared by the doctor after the diagnosis, they are sent for further testing to us in the lab. What we do is we collect the patient sample. Patients who have a history of diabetes or who are diabetic, there are tests that we run for them. Like there are different, it's called panels. There are different panels we run for them. There's FLP, that's fasting lipid profile. There's the glucose part, and there's these are just tests to check for there's fasting blood sugar, there's random blood sugar, there's oral glucose tolerance test. These are like panels that you use to check. So for a patient who is diabetic, you can also know, when I say holistic, it means like the complete, like a whole check. So from these automated tests, you can know whether a patient has, like you can know to the extent of which the diabetes or of which the patient's sugar is. There's also something called glycated hemoglobin. This HbA1c, which is a test which we run it to know whether, like, it's more of a confirmatory test for a patient who has diabetes, because someone can be pre-diabetic or can have a spike in their sugar and they can be diagnosed as being diabetic. But if you really want to make sure or know if the patient is diabetic, you send them for glycated hemoglobin. So what this test does is it breaks down the red cells. We use reagents and all these things. These are deeper aspects of it. But we use reagents and all these other things to break down the patient's red blood cells so that the red blood cell can break and release its content, where it is now measured in a chamber. Like we use a machine called Selectra Pro S. That's the machine we use. So to know particularly if a patient, because so many things can be suspected when someone is having an illness. Like different illnesses have the same symptoms. So for you to be sure, or for you to break down to its roots what is actually wrong with the patient, automation is one of the best ways to do that. Also, in hematology or in some other aspects of medical laboratory, there's a panel for full blood count, FBC, that's full blood counting. So this checks the level of all the blood parameters. The blood is the largest connective tissue in our bodies, and some of the contents of the blood include erythrocytes, the lymphocytes, the basophils, and the monocytes. All these components make up the blood. So for you to know if a patient is anemic, for you to know if a patient is has any form of blood disorder, or the possibilities are endless. You have to, or not you have to, but automation is just the way to be sure of yourself and clear your conscience that you've actually done a good job for the patient.
Yeah. Now, at some point, you also talked about laboratory information management systems. Would you consider that as a form of automation also?
Yes, it is.
All right. Because
yes, it is. It's a form of automation where, okay, sorry, I'm holding on. Go ahead.
No, go. It's fine.
Okay. All right. It is LIMS, Laboratory Information Management Systems, or LIMS for short. It's the system where it's how we use to monitor a patient's history over time. So if a patient makes frequent hospital visits, let's say visits the hospital 4 to 5, like for those ones who have chronic illnesses, 4 to 5 times a year, LIMS is used to monitor their track record, see the progress in their healing, see whether they are, whether they are being properly managed, to see if to see if their disease is getting worse or is getting better, just to it gives a general overview of how well the patient is doing.
So that would be particularly interesting for a patient, for example, that has diabetes, right? So someone that comes in every once in a while, so that you can be able to follow them, can be able to tell whether they are managing their diabetes correctly, especially that it's a disease that would probably have to be managed over their whole lifetime. And so you can see, okay, if there are periods where they are doing what they are supposed to do, or periods where, let's say, they ate a lot more sugars, periods where they were managing things correctly.
Periods where they derail. You can also tell, when they relapse, because it's not easy being a human being and managing an illness, because you have urges. You have some patients might be diabetic, but they also like to smoke. Some patients might be diabetic and they like to drink. So it's not really the easiest thing. Developing self-control is not so easy. So we try to use that as a track record to guide us, and also to counsel them on the ways to live a better life, live a more, productive and easier life, while on treatment. So that's one of the advantages of the LIMS.
Yeah. Now, for those who are looking at automation as more of a mechanistic thing where you are bringing in equipment, one of the things they may use as a negative is that when you buy equipment and then you bring it to our countries, the equipment is not necessarily adapted to our environment, or even in some cases when the equipment fails. It's extremely expensive to repair because you might have to get someone from the main company, the mother company, that you have to pay to come over, and can be extremely expensive. So what can be done in those cases? Are there ways of going around that? Are there cheaper ways of solving that sort of issue?
People who see automation just as mechanics. Yes, it is mechanics, but it is mechanics that helps us. It is mechanics that helps us grow as individuals, as a species. Without automation, the truth is, without automation, currently the medical field would not be as easy or as fluent as it is. Automation has helped us in so many ways, and yes, like I mentioned earlier, it has its disadvantages. It can be quite expensive to maintain. Most of these equipments are sourced from companies whereby let's say there's a middleman for a particular continent, and because in the lab I work in, we use Leica systems. So here in Nigeria, Leica has a parent body, like they have a branch here in Nigeria.
Okay.
So we go to them. We acquire these machines from them, and then they also have personnel who have trained and given certifications to fix and also work on different machines and in different aspects. And also these machines use reagents. It's important for whoever is managing these machines. First of all, you're trained, you're given like a form of a training before these machines are even installed. Whoever is in charge of the lab, or whoever is in charge of that particular unit, and people under them, they are trained on how to use these machines. They go on courses. It could last a month. It could last even longer than a month, just to, it's part of the career development program to give them more of a full view, a 360 understanding of the machine. So afterwards, the reagents and whatever is used on these machines are sourced from those companies that I mentioned earlier. Like you just don't go out and buy any reagent and use on any machine. That's part of the maintenance. And these machines come with warranties as well. It might be expensive, yes, but that's why it has a warranty. The warranty helps to give you some form of cover, some form of protection, because it's not the easiest thing to fix if it's broken down. So you have a warranty. Afterwards, subsequent maintenance or subsequent changes or subsequent, just general maintenance on the machine isn't so expensive as people think. It's not as expensive as it sounds. Yeah. Some things might break down in the machine because of maybe carelessness or wrong voltage, or, there can be different issues. In Africa here, we don't have steady lights. We don't have steady electricity. So those things also can be another cost. For you to prevent it and have 100% uptime while planning to bring in these machines, you also, or the body, because I work for a federal medical center, which is like a federal hospital. So
Mm-hmm.
they take into consideration these issues we have here in Africa, here in Nigeria, and provide some form of backup power for those machines, specifically for the machines, so that if there's a power outage, it doesn't affect the voltage, or it doesn't affect the capacitor or the integrated circuit or anything inside of the machine.
Yeah.
And that's one of the ways, like, it's just not a mechanistic thing. It's actually, when you start to use a machine, it's just like getting a new laptop. A laptop is a machine. When you start to use a machine over time, use it to solve problems, use it to do certain things, you kind of create a bond with that machine. I don't know, I don't know if I'm drifting from the topic, but this is true. Like, you kind of create a bond with you and the machine. And the workflow becomes much better.
Yeah, because you
over
get
time,
used
as
to
you
it.
understand.
Yeah, you understand
Exactly,
the
as
way
you
it
understand how
works.
to
You
use the machine.
understand, even if it has imperfections, you understand the imperfections, and so you know what you can do and you know what you cannot do.
Exactly. Also, adapting of equipment. Well, when these machines come in, yes, some of the equipment, some of the manual equipment we use, or some of the manual ways we used to do things, it's kind of phased out. But then again, we can also go back to them. We can also fall back on them, because like where I work, we use the manual to teach interns, like to teach people who are just coming up. Yeah, we use it to teach them and show them what is actually going on in the machine. For something like fasting, a test that can be, let me say, liver function test or kidney function test. There is a whole manual setup to that's where you titrate and pipette from back and forth until you get your coloration and all those things. We use that for training, but when it comes to the actual treatment of patients, we just go straight to the machine. So those other ways are not redundant. They're not completely written off. They're still there.
Yeah.
And it helps, because someone who understands the manual can easily move on to the automated aspect of it and do well in the automated aspect.
Yeah.
And also, it may break down. These machines break down. These machines can have, problems. That's where the diversification comes in. In the medical field now, everyone is either a doctor or a pharmacist or a lab scientist. I feel we need more encouragement, or we need to encourage our youth, or the upcoming youth, to look more into other aspects of the medical field. You can be a biomedical engineer, and your job is to look into machines. If you have an affinity for physics and you like biology as well, your job can be to be a technician, be a tech, be a machine tech. If there's anything wrong with it, you're called in, you work on it, and you're paid, and they make good money, because a lot of medical centers have this thing where they have a week where they have the least work, and that's where they run the most maintenance. So it's also a form of incentive. It's also a form of employment opportunity for young people out there who might have a degree in one area of the medical field or another. They can go into
get paid too.
Into biomedical engineering and get paid. And
because
it's a machine.
I was recently having an interview with someone else. We were talking about the fact that medical laboratory scientists do need to get into some more fields like forensics and then event research. And then we also got to talking about biomedical engineering. He was giving the example of someone that was invited from a country in East Africa to come to Nigeria in order to do servicing on biosafety cabinets. They paid for his transport. He came. They paid for his accommodation, and then they paid him $1,600 in order to do the maintenance, because the machine itself didn't have any particular issue, but since it's standardized, every 6 months they have to check it and then make sure it works.
The calibration and all that.
All he did is he spent about 30 minutes in the lab. He got his $1,600 and then he went back. So it's a field
and people.
So a lot of help is actually needed.
It's actually Yes. It's actually it's a virgin field. People haven't really started thinking that way. So whoever gets into it now is getting into it early, because there's something called quality control. Every day you print out your control for these auto analyzers. Okay, let me give you a quick backstory, a quick intro. So some patients, as you have a wide range of patients, you can have patients because in chemical pathology, what we do in chemical pathology is read numbers. We read like the derangement in the values of body fluids.
Yeah.
So the derangement in the values of body fluids. So someone can come in with a kidney problem or hepatocyte problem, and some of their values might be so low that to the machine, it might read as an error. Some of them might actually have hepatitis and their values are so high that it could also read as an error. So every day we do something called quality control. You run your control and make sure it passes. There's a low point and a high point, or low limit and a high limit, so that the machine is able to pick up a wide range of results and not flag it as an error.
Yeah.
So when it comes to quality control and calibration, people can actually go into that field and become professional calibrators, and just their work is to come in once every week or once every month, or depending on whatever the whole setup is of a medical, establishment. They can come in and run these quality checks, run their controls, and make their money. All you're doing is make sure the low and high reference ranges, they tally, and you're making your money. Like that's another aspect of biomedical engineering.
Yeah, we do need that, because I mean, yes, it's true that in our labs some of our scientists can do that, but the problem is they already have so much work to do that in many cases they don't necessarily find the time to do it the way it's supposed to be done. But if you can find a specialist whose role it is to do just that, it's a lot easier. You get a higher quality of results. And also, as soon as you have a problem, you know
exactly.
who to call. Yeah.
Exactly. You outsource it. Exactly. You outsource the problem and have them be responsible for your results, so that if there's any discrepancies, it's the same person and they can always recall their steps and do it the right way.
And so earlier on, you talked about disadvantages. We've been talking about the good aspects. For the most part, we talked about some disadvantages, but what could be some disadvantages of automation?
Some of the disadvantages, like let me not say like we all know, but some of the most obvious disadvantages of automation is job insecurity. When these machines come in, the work of 5 people or 10 people can be done by a single machine, manned by one person. That is one of the major disadvantages. Another disadvantage of automation is it encourages like a lazy attitude. When you work on a machine for so long, you feel you're so conversant with it, you don't really take as much time or as much precaution as you did in the beginning to make sure that everything is in order before you start running your tests. Like, it encourages this laziness in a way, because for you to because let me say, if you're on call, for example, and it's a slow day, you're not having that many requests for tests and stuff, you can just say, okay, let me relax. When I get more samples, I'll run them at the same time, because most of these auto analyzers can do batch processing, like they process in batches. So it's pointless running only one sample when you can run 15 and save your reagent. So, and that makes it, it makes it more difficult for the patients, because a patient can come as early as 9 a.m. and by 2 p.m. their result is still not out, because you're waiting for more patients to come. It gives you this lazy attitude. That's another disadvantage of automation. Then again, when it comes to productivity, how does it affect productivity? Well, automation actually does affect productivity, because a scientist is no longer you're no longer keen on, looking for new avenues to solve problems. You just relax. Like, it's still part of the lack of productivity. Like, it creates a lazy environment, and they do not devote like a substantial amount of time, to monitor these systems and monitor this processing. So these machines are computers. They are machines, literally garbage in, garbage out. What you give it is what it gives you back. So if you do not take proper time to monitor the systems and do the proper checks and all that, then you may not have the best of results. So these are some of the disadvantages, some of the most obvious disadvantages of automation.
Yeah. Now, for anyone who is interested in this, do you have any words of encouragement or words of advice? What should they be doing to try and help out in their various labs?
Okay. Well, there are online, pretty much, the world has gone digital. So personally, what I do is I go online, I look for workshops, I look for platforms where I can learn what I can, try and broaden my knowledge of the medical field in general. Currently in the hospital I work in histopathology, histopathology deals in morbid anatomy, and anatomical histology and the rest. So
Yeah.
in those areas, we use hard chemicals, we use carcinogenic chemicals like formalin, formaldehyde, and all these harsh chemicals. But for someone who is trying to get into automation and all that, you can, and especially if you're working for a body, you can go ahead and make your own findings. Go ahead, make some research, because now there are different ways to do things, and most of the new medical laboratory practices are more biased towards the safety of the scientists, like the safety of the medical personnel. Their safety is as important as the job that they're actually doing.
Yeah, of course.
So finding new ways to do things, or finding healthier ways, finding ways that will reduce the work hazard is one of the most important things anyone who is looking into getting into automation or anything can, look into, like finding ways to reduce work hazards, because automation actually, in as much as it helps, it actually brings up hazards as well. Because not just that generally working in the lab is a hazardous work. That's why there should be substantial hazard allowance and all that. So
Yeah,
whoever is looking into going into automation, I feel like
I was saying just that, yes, we need a lot more talks about this particular aspect about hazard allowance and that sort of thing, because it's not even just about being in contact with pathological specimens. Sometimes it's even physical, because I know a bunch of people who are in the field, and then after a couple of years, they start complaining about joint pains, back pains, knee pains, and that are
chest pain,
that are there and that never really leave. And so we also need to start thinking about ways of helping them in those areas so that they can work in a more healthy condition for a longer period of time. Because if someone is there working, and while he's working, he has to be worried about his back pain, you don't know the kind of errors he might be making while doing his work. So those are things we need to be taking into account.
Exactly. And in the medical field, we do not make mistakes. It's mostly errors. If you make a mistake, it's an error. Like there's no such thing as, oh, I made a mistake. You're dealing with human life, so that's an error. So, it's easier to correct a mistake, but an error is an error. So, and especially when you're dealing with samples that come from biopsies, you can't really give much room for those types of errors, because imagine, for example, a biopsy of an ovary, of like an ovarian cyst, and it's messed up in the processing, or maybe because someone is feeling dizzy from the fumes. Formaldehyde is actually a very pungent, and it's carcinogenic, it's pungent, and it can also make someone feel dizzy. So imagine working with that, and you have a face mask on, and you're working, and then you start feeling dizzy, and you're working with samples from biopsies, and you know that those samples, if you mess it up, it cannot be gotten back, because you can't call back the patient and say, oh, sorry, we messed up a sample, let's get another one, we need to do another operation. That's not possible. So looking into those aspects, looking into those areas where we actually do better, I feel is one of the key aspects, key things anyone who's trying to get into automation can do.
And I think going from the example you're giving also about someone getting dizzy, automation also helps in the sense that if you can have, because in many of our, at least in some of our labs, depending on the kind of lab you're in, there is usually always this problem of shortage and not having enough people there for a shift, and not necessarily having the number of people you need to double check the work. Automation, if it's well done, could also help a little bit with those aspects, so that even if those people are not around, even if you don't have a second human being there to check, at least you can have a machine that's going to perform some sort of basic check to help reduce already the number of errors.
Exactly. And there are also, machines that work overnight for tissue processing, for you to be able to process a tissue from when it's being harvested to processing it enough for embedding. It's mostly done by an by an ATP or automatic tissue processor. So, the constant agitation, the constant moving from one grade of alcohol to another, it's quite tedious, and it's only a machine that can do it and do it perfectly. So those are some of the challenges we normally have.
All right. So any last words for the audience?
I'd like to say a big thank you for this opportunity given to me to speak on something I have some knowledge about. Whoever is looking into getting into automation, I wish you the best. I give you all the encouragement. If you already have a degree in a form of a subunit of medicine, or in medicine, maybe microbiology, biochemistry, whatever degree you have, you're not limited. That's the message I'm trying to give. You're not limited to your BSc or to your diploma. You're not limited to that. There's so many things you can do. Like, there's so many certifications you can get. You can even become a certified safety officer. You can be anything. And and also help in monitoring these automated systems and making sure that, they pass the checks. It's just a form of encouragement to anyone who's in the medical field already to, push the frontiers, man. There's so much we can do. There's so much more to be done, especially in our continent in Africa. There's a lot of work for us to do. So the earlier we start, the better.
Yeah, you touched on something that I also think, based on when you're talking about the safety officers and other people that help look at the equipment. One thing about technology is it removes jobs, but it also creates new ones. And that's always been what we've seen.
Exactly.
As it's removing the old jobs, it's creating new jobs. So if you're looking towards the future,
it's creating new jobs,
advancing, what's usually going to happen is, if you are teaching yourself new skills, by the time you are being replaced, you find something else, and then you can then move to the next level. And I think that's what we should all be trying to aim towards in our various positions. So thanks a lot for being here with us today. Hopefully we'll have you very soon again to talk a little bit more about automation, and maybe in some more detail of how it helps you in your job every day. Thanks a lot, and see you next time.
Thank you for having me. Thank you for having me.
Thank you.
All right. I appreciate it. Thank you for having me. Yeah.
All right.